Hello?
Hi there, is that Renee?
Yeah, how's it going?
I'm good, thanks. How are you?
I'm okay.
Good. Renee, my name is Rachel, and I'm calling from the Carers Clinic here in Victoria.
Oh,
And I'm calling,
interesting. The CARES Clinic.
yeah, have you heard of us?
Yeah, a police officer tried to push me talking to you guys not that long ago.
Oh, okay. We did receive a referral. I believe it was from your doctor. Are you still interested in the appointment?
Well, this came to a surprise because like my doctor didn't inform me about this, right?
Okay.
So
Um,
I'm curious on like why the referral.
let's see here. Well, I believe that they called you. We have notes here saying that they called you perhaps on the 15th of April.
Who did?
Saying that you were supportive of the referral. Do you recall a conversation from the clinic checking in with you?
No.
No? Okay. Well, the point of our conversation today is just to kind of have a chat to see what's been going on for you in terms of if you have any mental health concerns and if you'd like any resources or supports to support you.
Interesting. So this is to like cover the police's butt, right? For not doing the job?
No, no. So this has nothing to do with the police. Um, Renee, just before we chat some further, actually, just in terms of confirming who you are, and just to make sure that I'm speaking with the right person, would you mind just confirming your full name? So, Renee, just so you're aware, any of the information that we discussed today is just between anyone at Island Health that would be in charge of your care plan, okay? So, the police or anything like that don't get a hold of this information. The only reason we would need to share your information elsewhere would be if we felt that you were of imminent risk to yourself, or if there was a child in your care, or if your records were subpoenaed to court, okay? So, pretty just exceptional cases.
What does the child in my care have to do with anything?
Well, just for example, if you were, taking care of a dependent child and we felt that they were at risk of harm, that we would need to intervene. So, Renee, I'm just
But I
wondering
don't
in
have any
terms of,
kids.
oh, okay, perfect. Then that doesn't apply to you then. Renee, in terms of, um, in terms of kind of been what's been going on for you, were you looking to proceed with the appointment today?
So on January 20th, was it January 20th? Are you guys familiar that I had a police psychiatric intake on January 16th? Is that on record? It was like an hour long. The police issued it.
Oh, okay. It was on January 20th this year.
January 16th, 2024. Psychiatric intake across the street from the RCMP headquarters.
Let me see here. I don't believe we have anything. Oh, for January, was it January 25th?
January 16th, 2024.
Okay. I don't have anything for January 16th.
What do you have?
Well, I was just notified that on January on 25th that um let's see here. Yeah, so on January 25th we received a referral from your doctor. So with regards to that was with regards to getting an assessment for ICBC. Is that right?
Oh, really? But I didn't speak with you guys?
No. So yeah, so you didn't need to come to us for that, so we don't provide that service. and we redirected you
Oh
to like
yeah.
a
Oh, I remember now. There's oh yeah, a gentleman called me, and so the so the doctor referred that to me. The gentleman called me from your clinic, and he said that you guys don't offer that, and he told me to go on to like a website for like nurses or like psychologists and
yeah,
stuff.
an urgent primary care clinic.
Yeah, and then I emailed like 3 or 4 of them, and they don't deal with that either because my
Oh,
because
okay.
my class 1 driver's license was taken away um, in December, I think, because I got a letter from Drive Safe BC ICBC in November, and I was given strict timeline on 30 days to deal with it, and I had to like pass some test. So, and I brought it to Dr. Nielsen, this Squamble Medical Clinic, and urged them that it was like extremely important because I live in my car, right, for like almost 8 years now.
Okay.
So like having a driver's license is important,
Of course, yeah.
and I've been driving class 1 for almost no for over 20 years now,
Hmm.
and yeah, and he gave me the runaround. So, and also it's under my impression when I call Drive Safe BC that one of the nurses or the management staff sent off the letter because I asked Dr. Nielsen, since he couldn't see me for some odd reason, even though it was so important. Um, they someone sent off a letter to Drive Safe BC, and they already got something saying I'm not sure what it was, but then without me seeing like Dr. Nielsen, and he was supposed to like a doctor is the only one that can request like more time, like I need
Okay.
more time because it was like around Christmas time, like a doctor shortage, and
Okay.
so I got a letter back and saying that my license was canceled. So then,
Oh,
not that long after that, once it was canceled, I was able to do this simple test. I forget what it was called, but like a nurse just did it, and I got 20. I passed with a 27 out of 30, and but then it was too late. So now it's been like 4 or 5 months now. And my license has been canceled, and I'm getting the runaround.
okay. So you're
Well, I'm jumping.
unable to get the license.
Well, like I'm jumping through all the hoops, and like, and I quote Dr. Nielsen said. He said, "They're really giving you a hard time."
Yeah. So you're trying to find clarity on how to get your license renewed?
Well, I actually didn't. I already knew like what was happening. That like the police
Okay.
are like professionals are trying to put blame on me for what's happening to me for being wrongfully terminated from Purelator, because I was wrongfully terminated at Coca-Cola, but I proved unsafe work practices and me being mobbed in the workplace. So my union we ended up settling, and they ended up paying me $10,000.
Okay.
And like mobbing is, are you familiar with mobbing?
No.
So it's plural for bullying.
Oh, I see. Okay. I'm sorry you experienced that.
So, um, so they ended up paying me like $10,000, but Coca-Cola was just trying to push me out because organized crime is attacking me. So,
Okay.
and I recently just got a bunch of like voicemails on like a local 81 associate asking if I want a hand or a foot cut off, among other things.
Oh, wow.
So like I don't know how like a normal person would act to that on if like if I were to ask you like, hey, like how would you like a hand or a foot cut off? That sounds kind of
Yeah.
not normal, right?
Yeah, that's concerning for sure. Yeah.
so 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 then like that same person also like did a bunch of things, and like emailed like the rec center that I'm going to, and then like the rec center ended up banning me like recently because
Oh,
because that person emailed management,
oh, I see. Okay.
and then like that person is now contacting people that I know, and they're asking me like, hey, like, is this your friend? I'm like, no, I don't know this person, he's a stalker at this
Okay.
point.
Okay. So Renee, in terms of like, so the resources that we can provide here at the clinic, or anything mental health related, were you interested in receiving anything like that today?
Well, so the referral was from Dr. Nielsen, right?
Yes, that's right.
And Dr. Nielsen recently filled out a form that I'm battling depression.
That you're filing depression?
That I'm battling depression. Yeah.
Oh, okay. So for in terms of connecting with us today, like we can make referrals to like psychiatry and counseling and things like that, depending on what you're looking for and what your symptoms are. Do you have any interest in that?
So I've never suffered from depression before, right?
Oh, yeah.
Um,
Okay. So
on,
you don't feel that's applicable to you?
on January 4th of 2024, an officer that works out of your clinic, the CARES clinic, I just found the post. We talked for about 20 minutes. He called me and he said that he wanted me to come in and talk to you guys.
Okay. We don't actually have any police officers here at the clinic.
Well, I had the 20-minute recording posted on January 4th of me talking to him and him saying that he works out of your clinic and that it's around the corner from the Vic PD police station.
Oh, interesting. Okay. Okay.
So you don't have like a record of on January 4th of a police officer contacting me working out of your clinic? Because I have it all recorded.
Yeah, so as I said, we don't have a police officer that works here, but if it was they might have been working for the insert team.
Yeah, maybe that's what it is. That's kind of
Yeah,
that kind of rings
I
a
think
bell.
that's what it might have been. Yeah. So they had some concerns and just wanted to see if you wanted to follow up in terms of your symptoms of mental health, or you wanted any support there.
Huh. It seems like you're putting a lot of blame on me, right? Because I told you that like this is all new to me, and
Yeah, so Renee, I just want to assure you, we're not, you don't have to go ahead with this phone call, or we're not putting any pressure on you in terms of any blame or anything like that. The reason I'm just calling today is to see if you want any help with
well,
regards
that's just how
to
I feel.
anything.
Well, that's how I feel, right? So
Yeah.
how does one go about like someone calling and saying that they want their hand and foot cut off, or your doctor giving you the runaround and your license is canceled, but you live in your car, and I had to drive to Alberta and get a Alberta driver's license. And just before I saw Dr. Nielsen on like a couple weeks ago, I was pulled over at 1 in the morning from Sandwich Police from a ride check when I was going to go charge my car, and they asked for my license, but my wallet was stolen, and they never gave me a ticket or anything.
Okay. Yeah, it sounds like
This is
some
this is on
frustrating.
this was on April 2nd, and
So,
Drive Safe BC and ICBC ended up sending me like another letter, and I ended up
okay.
voluntarily offering to pee in a cup for Dr. Nielsen because a lot of questions from Drive Safe BC have been coming up, and one of the things that police labeled me was paranoid,
Okay. And
and
how do you feel about that?
that I have hard evidence on me being attacked. So that's obviously just a cop out for police not to do their job properly.
Okay. Okay. So in terms
Because
of
that's what's
Renee, you
happening,
asked
right?
about.
Is that police are not doing their job properly, right? Because they're supposed to be handling this, right? And it seems that
Okay.
they're going kind of behind the scenes to do as least as possible. And then now,
Mm,
so on January 2nd, that officer out of your clinic calls me, and then on January 16th, I'm then forced by police to go to a psych intake, and then I never hear back from them. And then now Dr. Nielsen, when I saw him on April 2nd, he was supposed to fill out a form. He called me he was supposed to call me on Saturday. He lied and said that my phone was disconnected, which I've never had my phone in my lifetime ever disconnected. So he never called me on a scheduled appointment. Then I scheduled a meeting with him in person and asked if he filled out this form again because it's been 4 months. And then he said that he was sick, and I asked him how long he was sick for. He said 1 week. And I said, it's been 6 weeks. You haven't filled out the form and sent it off to Drive Safe BC? And then you know what he said to me? He said, well, I thought you might have left. Like I might have like moved away, which
Okay.
which is what the stalker in the voicemails was telling me to do. He was threatening me and warning me that he wants me to leave the province. He wants me to go to Alberta or Ontario. With his
Okay.
he's trying to figure out, and his Facebook has like bikers of like Local 81 on his Facebook, and he's telling me, and I have it all recorded about him trying to figure out how to like get me in the hospital, a hand or a foot cut off, maybe just a toe.
Yeah, I can see how that would be,
And then
quite scary, Renee.
and then I had a masked man on November 2022 pull a gun on me at 4 a.m. Like, it's like people are trying to scare me out of the province, and then all of a sudden now I can't get my BC driver's license back either.
Yeah. Yeah, I can see your frustrations here. So in terms of, Renee, what I can do for you today, I said if you're not interested in any mental health services.
Yeah, I said a lot. What can you? Well, did I say that I wasn't interested? What exactly should I do with all these concerns? It sounds like you don't care.
No, absolutely. I very much care. Yeah, I'm just trying to, I'll just ask a few times, if you're interested. So what we can do for you is we can connect you with different kind of supports. So be it, if you were looking to see psychiatry, to chat about any concerns you had, or if you're looking to go to like mental health counseling support.
That's not the first time you've mentioned this phone call about psychiatry. They deal with like popping pills, right?
So they deal with, providing more information about assessment and diagnoses, and they provide information around treatment options and
Do you
medication.
think under my circumstances, with a little bit of information that I've given you, do you think that I need psychiatry?
That would be totally up to you. Yeah. So I'm not here to tell you, over a brief phone call, what may be going on for you.
But you brought it up more than once, though.
Yeah, because this is a service we provide. So if you're not looking for these services, I don't want to take up any more of your time. But if you are interested, I'd be happy to provide them for you.
Am I? It's only been 17 minutes. I thought this phone call was scheduled for 45 minutes to an hour.
Yeah, Renee, I'm just letting you know that, I'm letting you know the services we provide, right? So they revolve around psychiatry.
Well, I told you I'm suffering from depression. So does like psychiatry handles depression?
Absolutely, yeah. Anything with regards to mental health, if you wanted to chat with them, you'd be welcome to do so.
But I thought you don't chat to psychiatrists, you talk to like psychologists.
No, it would be a psychiatrist, so you would have like an hour's appointment with them, and they would do, depending on what you're looking for, they could do an assessment and provide, kind of different insights, doing an assessment on your mental health. And then you're welcome to take the information or leave it, but it's just a professional providing some support for you. You don't have to follow through with any kind of recommendations or anything after that. It's just more information for your well-being. How does that sound to you?
Like bullshit.
Okay, so yeah. So the other option, if you're not interested in that, Renee.
Yeah. What other services do you guys offer?
We have other outreach teams too. If you wanted people to connect with you. I know you mentioned that you're living in your car.
So like that police officer mentioned, he can come to me. Is that what you're talking about? Whatever like department he works in?
Yeah, or it could be like an outreach worker, so someone to kind of check in with you if if you wanted help getting paperwork done for ICBC or making appointments, or kind of just keeping just kind of like a support service.
Well, a physician is supposed to do the paperwork and all that stuff, and my doctor is been proven to be wasting time and give me the runaround. Right? Like, so like I don't, so the police like took away my BC driver's license, and now the doctor is giving me the runaround and to not give it back. And he's supposed to fill out the paperwork, but he's proven to like not really care.
Yeah, so what I'm saying is, we could connect you with an outreach team that would support you with that, right? That could help get some answers and kind of figure it out for you.
What does the average person suffering from depression usually like do?
Depression can show up in different ways to different people, but usually, it can show up in low mood, lack of motivation, apathy, just kind of, having trouble with everyday kind of activities of living.
So like
Um,
not walking or not moving for months, like literally not walking for months, would that be a form of depression?
it could be like in terms of,
Persistent
just
feelings of
not
sadness, emptiness, hopelessness,
exactly. Yeah, they're all aspects of depression.
loss of interest or pleasure from being mobbed, and
Yeah,
and
would
and
you say
then
that
and
they're all?
then and then police putting blame on me as I'm paranoid, which I have nothing but evidence on me being attacked.
Yeah, absolutely. They're all things that could contribute to depression for sure.
Difficulty sleeping,
Yeah,
fatigue.
yeah. Are they all things that you relate to, Renee?
Oh, I'm just reading the definition of depression from Grok.
Okay. Yeah. Are they things that you relate to?
Well, no, like I told you what I was relating to about me not moving or walking and stuff.
Yeah.
So, like, do you guys offer like rehabilitation and stuff, like therapy?
So what we do is we would do an assessment and then provide resources from there. So we would do a more in depth. So we don't do rehabilitation, but we would provide you with resources that could support with rehabilitation.
Okay, from a psychiatrist.
Yeah. Pardon me?
From a psychiatrist.
Yeah, so they would do the initial assessment
Okay.
and they would provide resources for rehabilitation.
Do you guys do you have any? And the psychiatrist isn't in your facility, is it right? You guys only have like.
They, they are in our facility. Yeah, that's correct.
Okay.
Yeah, what are your thoughts around that?
I'm just thinking.
Yeah. And if you wanted some more time to think about it too, Renee, we could set up another appointment to chat some more about it and go into detail. If now wasn't the time that you would wanted to proceed, there's absolutely no pressure.
No, I tried chatting already during this phone call, and I don't feel satisfied with it.
Okay, I'm sorry to hear that. Is there anything you'd like me to know?
I don't have anything nice to say.
Okay.
Right? I mean, like, it's probably not your fault. It's probably just what you're capable of in the position that you're in.
Well, if I knew what you were looking for or how I can support you, I'd be happy to, try meet you there.
You don't know what I'm looking for?
Yeah, I don't know. I'm trying to seek clarification on that. It sounded like it was with regards to the driver's license.
Yeah, it would be nice if I could do my trade that I've had for over 20 years since I've been 18. If I can have that back and not be pushed away to the province where people don't want to deal with what's actually happening to me, right? Instead of having a psychiatrist force mental health or try to have some asshole speak for me that doesn't give a shit, after 9 to 5. That would be
Yeah.
nice if police could actually admit that organized crime is attacking me. And I've been on a run across 4 provinces for years now. That would be nice, and blame not put on me.
Yeah.
But I don't know
Yeah.
if I don't think there's anything that you can do like other than that, right?
Mhm. Well,
I could just
I know.
keep on bitching and wasting your time.
Well, I know you mentioned, needing some help kind of like connecting with, kind of getting the driver's license done and kind of getting support. We do have some information with like for other resources that I could connect you with that could help you with some of that kind of, some of those items.
I'm all ears.
Yeah. So there's an organization called the Mental Health Recovery Partners, and they actually provide resources on navigating different on the system. So like different in terms of it could be in terms of like housing, it could be in terms of getting your ICB license, it could be seeking kind of seeking counseling and that kind of thing. So they have different resources that they could provide for you. And I can give you their contact number as well if you were interested in that.
This seems like a collaborative way to cripple me. This seems like the whole goal, right? Police, this local 81, the doctor, it's all to either leave the province because we don't want to deal with it, or this stalker that's leaving voicemails was telling me about how can I get you? You should be on like disability. You should do this. It's not about what Renee wants. It's about crippling me and delegating on my life, and I can't work the jobs I want. Otherwise, complaints miraculously like come in, and I'm being offered and like pushed in like different religious groups. If I don't sign up for a religion, well then I'm going to be mobbed and bullied. So is this what's going on in this province, that just gatekeeping and religious groups own like different jobs, and you can't do this or that, otherwise you'll be mobbed and there's nothing you can do, otherwise see a psychiatrist or be on the streets and have like housing because you can't get a job, or leave the province? That like those are the only options?
Yeah, so they're not the only options.
So
And
what do you
I'm
do with
just trying to,
gatekeeping or mobbing? Like who handles that? The police, right?
that would generally be the police. Yeah. Yeah.
Okay, cool. So
Yeah.
I guess I should probably just talk to the police about what's happening, because then if they can fix it, then my depression will go away.
Okay. Yeah. Did you want any other resources in terms of like getting like documents or paperwork or anything like that helps with?
No, ICBC Drive Safe BC says that it needs to have a physician fill out all that stuff.
Okay.
So Dr. Nielsen has all those forms, and I've been pretty patient, but I still haven't received anything back from them. So hopefully he can continue finishing those forms and send them off, and Drive
Okay.
Safe BC can stop being assholes and give me my license back.
Yeah. Yeah.
Right?
Yeah. I hope they're
Because
more
because
supportive of it.
yeah, because at this point they're fucking assholes, because I'm living in my car and they took away my license.
Mhm.
Right? Do you agree?
That sounds like an extremely challenging situation. Yeah. Absolutely.
Yeah, it is. That's one way to put it.
Yeah. 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 Renee, is there anything I can do today to kind of to help or support you?
Would you agree it's just awkward to continue this by just keep
Pardon
on?
me?
Would it be fair to say that it's just awkward to continue this conversation? Sorry, I don't talk, right? Like I don't have anyone to talk to, so my like speaking abilities is trash. I'm terribly sorry.
No, that's okay. I don't feel awkward at all. I'm here to help in
I
any
just
way that
feel
I
like a
can.
babbling idiot sometimes because I don't actually speak, right? It's like a muscle I don't practice, unfortunately.
Okay, yeah. I can understand that. Yeah, absolutely. Yeah, as I said, I'm here to to talk with whatever you want and and support however I can within terms of mental health or just well-being support.
Do I hear an East Coast accent? Are you an East Coaster?
I'm Irish. Yeah, I'm
Okay,
Irish.
fair.
Yeah.
What's your
Yeah.
name again?
It's Rachel.
Rachel, okay. Well, I guess, Rachel, it was nice speaking with you.
Yeah, it was nice to speak with you too, Renee.
Oh, gosh.
Hello?
Oh, hi, sorry, like my car went on to like sleep mode and went to my phone instead.
Okay, okay. Well, Renee, do you have our number if you want to call back at any time?
I probably won't call you back.
Okay, that's no problem. Yeah.
So like, so what happens with this referral that Dr. Nielsen, like, so do you have any questions for me? Like, cause like, does Dr. Nielsen have any concerns, or cause he's the one that scheduled this, and I told you that it was kind of like a surprise, right?
Yes, yeah. So as I said, he had just some concerns just around, just with in regards to your mental health, just to check in to see if, after your recent incident with the police, just to see if you wanted any support.
Yeah, no, I just hoping I can get my BC driver's license back, and I don't think that's something you guys deal with, right? As I was told before. So.
Yeah, no, unfortunately not. But as I said, I can give you information for a resource that does help with that kind of thing.
So the only option to get my BC driver's license is to see a psychiatrist. Is that what you're telling me?
No, it's not. No, you don't have to see a psychiatrist. There are other community resources that could help you with getting the information you need for your license and that kind of thing.
But I have to go through the mental health form and to get my BC driver's license back. Is that what you're saying?
No, so this organization isn't an island health organization. It's a non-for-profit. It's just on Kings Road, and they provide help just with navigating different systems that can be challenging.
Okay.
Yeah. Did you want their information?
I don't. From my understanding, they can't help me get my driver's license back.
Okay. Yeah. They might not be able to, but they might also be able to help support you get what you need for your license. Whether that's, helping communicate with your doctor, getting more information, or
How about
filling out certain forms.
could you do me a favor? Could you just like shoot them like a quick note and tell them to let the police maybe do their job properly and stop putting blame on me? Could you do that for me?
Send who a note?
Send the people, this non-for-profit, tell them to tell the police to do their job properly.
Okay. Unfortunately, they won't be able to do that, and I won't be able to do that.
Okay.
Yeah.
Well, thanks, Rachel.
Okay. Thank you, Renee.
It was nice talking to you. Sorry. Thanks for putting up with me.
No problem at all. I said if we can help at all in future, just don't hesitate to call back.
Oh, okay.
Okay. You take care.
Okay, bye.